Welcome, welcome, welcome. Good evening, everybody. This is Nurse Eunice with Florida Training Academy, and we're going to give everybody a few moments, about 1 minute to get on, and we will begin our review. And so I'm just going to go ahead and go to the comments. If you would, please type your name and let me know where you are viewing from. And so again, this is Nurse Eunice, and I am located in Jacksonville, Florida, and we'll get started in about 45 more seconds. Hi, Nellie. I am good. How are you doing? Yes, it's cold in Jacksonville. If it gets less than 70 degrees, we're cold. So, but it's nice to have you on tonight. Okay, everybody. So, we're going to go ahead and get started. Thank you all for joining. All right. So, if you missed our introduction, my name is Eunice. I'm a registered nurse and the owner of Florida Training Academy. And tonight's video, we're going to do CPR questions. Tomorrow, it'll be infection control. And tomorrow, we'll try to start around 8 p.m. And of course, I will post that in the community section. And I will go ahead and repeat that information again towards the end of this video. So, hi, Lois. All right, so let's begin. Number one. What should you do first if you are alone and find an unconscious adult victim with no pulse? A says administer an AED. B, call 911. C, deliver 1 minute of CPR. D, deliver 2 minutes of CPR. What do you think the best answer is? Hi, Lisa from Orlando. And you know I don't give you much time to think, so we'll reveal the answer in 3, 2. Yes, Sandrine, it is B. Anyone else? Great job. So it is B. Because it said an adult victim, if an adult victim is pulseless, if they're in cardiac arrest, it is more than likely due to an abnormal heart rhythm. So if you're out and about, you don't have an AED with you. We need you to call for help right away. You are calling 911 because we need those advanced responders, those first responders to get there so we can, of course, get the AED put on this person as quickly as possible. After you call 911, while you have them on the phone, of course, they're going to ask you to do a quick assessment. You can start CPR after you phone 911. So great job. Good job, Sandrine. Number 2. If someone suffers cardiac arrest, meaning that their heart went into an electrical rhythm or it stopped altogether, either way, there's no perfusing blood. So let me repeat this. Number 2, if someone suffers cardiac arrest, how long should you take before starting CPR? A, 20 seconds, B, 10 seconds, C, 1 minute, or D, 30 seconds. Hi, Mamie. I don't want to mispronounce the first name, so I'll just say the last name. Metellus. I do apologize if I said it wrong, but hello. All right, you all. In 3, 2, 1, we'll reveal the answer. It's 10 seconds, so it is B. You're going to hear that a lot. That's like a common theme with CPR. You only get 10 minutes to assess, 10 seconds to assess. So you have to be on that chest, starting chest compressions within 10 seconds. And if you take your hands off the chest for any reason, if they're still in cardiac arrest, the goal is to be back on that chest within 10 seconds. So B was the correct answer for number 2. Number 3, this is a long one. While walking in the park, you see an unconscious adult. The adult is not breathing and doesn't have a pulse. What's the best thing you should do? A, perform CPR with chest compressions and rescue breathing. B, provide rescue breathing only. C, perform chest compressions only. D, Call 911 and wait for the EMS to arrive. In other words, you're not doing CPR, you're just waiting. And then E is either A or C. There's an unconscious adult that does not have a pulse. What do you think the best answer is? All right. Any takers? Mamie, Lois, Nellie, Sandrine? We're revealing the answer in 3, 2, 1. And everybody, it's not D because all it said was call 911 and just wait. Remember in the last one I was saying you'd have to call 911 and start CPR? So the answer wasn't D. It was actually either A or C. So yes, you want to call 911, but D wasn't correct because after calling 911, you're not going to wait. For every 1 minute you delay in starting your chest compressions, the adult victim loses 10% of their brain function. And in our area, it takes the paramedics, the ambulance, about 7 to 10 minutes to get to you. So if there is a cardiac emergency, we need people standing by who know what to do. So the answer is A or C because about 10 years ago, the American Heart Association, through their research, found that people were unwilling to provide aid because they didn't want to do mouth to mouth. And so the rescue breathing is actually optional. If you don't have protective equipment, you can perform chest compressions without breaths, and we call that compression only CPR. So if you feel like giving this person you don't know a rescue breath, by all means do so. So that's why it could be A. However, if you just want to perfuse blood and do chest compressions, you can also do that. So you don't have to risk your life to help save someone else's life, okay? Number 4, you try to give an unresponsive adult a rescue breath, and the chest does not appear to rise when you give the first breath. What do you do next? A, perform abdominal thrust. D, do chest compressions only. C, stop CPR and wait for EMS. D, repeat the head tilt, chin lift maneuver and attempt the breath again. You tried to give a breath, but you didn't see any chest rise. What do you do? Oh, you all are quiet tonight. Lois, for this one, it's not C because you don't want to stop CPR and wait for EMS. So, everybody, in 3, 2, and 1. It is D as in dog. So whenever you try to give a breath and you do the head tilt chin lift, the tongue is blocking the back of the throat. So this person may not have an obstructed airway. It's not that they choked. It's just that right now they're in cardiac arrest. And because they don't have any tone or any musculature, their tongue is collapsed. So whenever you do the head tilt chin lift, you're actually maneuvering the tongue so that when you give the breath, the tongue doesn't block the breath. So if you try to give a breath and you don't see chest rise and fall, just put the head back down, reposition again, and reattempt your breath. If you still don't have a breath that goes through, within 10 seconds, we need you back on that chest doing your compressions again, and we'll try that again after our 30 compressions, and we'll learn more about the numbers in a few moments. Number 5, after offering resuscitation in the event of a cardiac arrest, and your patient starts breathing, what is the best recovery position to put them in to maintain a clear airway? And this one's a little tricky, so let me read all of them. A, in a still position. B, in a left lateral position. C, in a lateral position, head dependent on something and no pressure on the chest. Or D, in a lateral position, head dependent on something with pressure on the chest. And I know most of the time you hear B in a lateral position, But give me another option, because in this case, the answer is not B. But Lois, you're close. It's not B. All right, everybody, we'll reveal the answer in 3, 2, 1. And I even have a picture here for you so that it will make more sense. So C states in a stable true lateral position, you want to have the head dependent on something and no pressure on the chest. So once the image actually shows, you're going to see that we support their head by placing their head on their arms. What happens is you still want to see the chest moving because we have them in a lateral position or the recovery position after cardiac arrest because we think the person might vomit. So you don't want their face towards the ground. So you want to keep them on the side. If you're unable to put their arms under their head, you can use a pillow or a purse. And so that's what it means by head dependent on something. And you don't want any pressure on the chest. So you don't want them laying on their chest. Number 6, you're walking along the sidewalk and see an unconscious child. What a scary sight. The child is in cardiac arrest. What is the first thing you should do if you did A, perform 2 minutes of CPR, B, call 911 and listen to everything before you give me your answer, C, perform chest compressions, or D, provide rescue breathing. So we talked about adults. If an adult goes into cardiac arrest, more than likely it was their heart being in an abnormal rhythm. Think of Damar Hamlin when he was hit on the football field. He immediately collapsed. With children and infants, it's a little bit different. If they go into cardiac arrest, it's normally not their heart that causes the arrest, it's their airway. They don't have enough oxygen, and then the heart muscle ends up dying, and that's what causes their cardiac arrest. So, if you have a child and you didn't witness the arrest, automatically assume they don't have enough oxygen. Your first priority would not be to call 911. So, with that being said, what's the best answer? Close. Everybody, it's going to be A. We need you to perform 2 minutes of CPR. So I want to go back and repeat that. Write some notes. If there is a child or an infant and you did not witness the arrest, you don't know how long that child has been on that ground. If you have your cell phone, yes, by all means, whip it out, call 911, put it on speakerphone. But if we don't have a cell phone, don't leave that child to go call 911 right away. We need you doing 2 minutes of CPR, including giving breaths to make sure that we get some oxygenated blood to that child's brain. Then you can leave to go call 911. So unwitnessed arrest in a child, 2 minutes of CPR first, and you call 911 second. And then don't forget the reason that a child or an infant goes into arrest is usually not cardiac, it's respiratory. So great job, ladies and gentlemen. Number 7, while performing CPR on a child, interruptions to chest compression should be limited to A, less than 10 seconds, B, less than 15 seconds, C, less than 20 seconds, or D, 1 minute. And I gave you this answer already. So, Lois, you have it. Great job, Lois. Anyone else? Hey, John from Kenya. Oh, please be safe and enjoy. I wish you well on your exams today. All right, so anyone else going to give an answer tonight? Looks like you have it, Lois. It is A. Yes, Mamie. Less than 10 seconds. So it doesn't matter the age, whenever you're performing CPR, if you have to stop your chest compressions to give breaths, to use the AED, whatever the case may be, try to get back to that chest within 10 seconds, okay? Number 8, while you are performing CPR on a child, another rescuer appears on the scene. What do you do next? A, transport the child immediately. B, wait until you feel exhausted, then ask the second rescuer to replace you. C, ask the second rescuer to help with CPR to minimize fatigue. D, ask the second rescuer to give rescue breaths at a ratio of 30-2. This one's tricky. The answer is not D. Give me another answer. It is C, John. You're right. Great job. And Nellie, I'm going to explain to you why it's not D. All right, so whenever that second rescuer comes up, they don't have to be certified in CPR to take over. But according to the American Heart Association guidelines, if you have help about every 2 minutes or 5 cycles, you should be switching out. Once you have help, and let's say you had a pocket mask or a bag mask device where you can be giving breaths to this child or an infant, if there are 2 or more rescuers, I want you to write this number down. If there are 2 or more rescuers, your ratio switches. It's no longer 30 compressions followed by 2 breaths. It'll be 15 compressions followed by 2 breaths. That means that within 2 minutes, you're giving that child double the quantity of breaths because it's 2 of you now. If you try to do 15-2 by yourself, you're going to be exhausted because you're trying to breathe 20 breaths per minute while giving this child 20 breaths per minute. So I'm going to recap. Regardless of the age, if it's a single rescuer for all ages, it is 30 compressions followed by 2 breaths. But for children and infants, once you have a second rescuer on the scene, it is no longer 30-2. It's 15-2. And the reason you're doing that is so that you can maximize those breaths to help reverse this child's arrest. So great job, team. And there's our answer. Number 9, what is the latest recommendation for CPR compression depth in an adult? Is it A, 1 to 2 inches, B, 2 inches, C, 2 to 2.4 inches, or D, 2 to 2.6 inches? So if you didn't study this, it's going to be hard for you to answer this. It's not D. Nellie said C. You're absolutely right, Nellie. That is correct. Anyone else? 3, 2, 1. Yes, Mamie. So, everybody, the answer is 2 to 2.4 inches. And that's just textbook. That's American Heart. But I have to throw a monkey wrench in there because it's 2 to 2.4 inches for an average size adult. You all, we're working on a bariatric unit today. And if you don't know what bariatric means, that's usually your obese patients. So usually they're in your facility because they're either being evaluated for weight loss surgery or they're post-op. They just had their surgeries. So for our scenario tonight, we have a 400-pound patient who went into cardiac arrest. We cannot compress 2 to 2.4 inches. That will not be deep enough. So there is another fraction that we use, and we call it 1/3 the depth of the chest. So you would bring that side view of the chest when you do your compressions 1/3 of the way in, because we have to get past the fat, the muscles, and the breastbone. There is a possibility that we may break ribs, but if we don't press deep enough, we're never going to get to the heart. And if we don't compress on that heart, we're not going to circulate any blood to the brain. The person's going to end up brain dead. So any damage we do to that chest, we can fix that with time and medication. But if you don't compress deeply enough, we cannot reverse that brain damage. Okay, so it's 2 to 2.4 inches, or another rule of thumb is 1/3. Number 10, according to the American Heart Association guidelines, what is the recommended chest compression rate during cardiac arrest management? Is it A, 100 to 120 compressions per minute, B, 90 to 100 compressions per minute, C, less than, I think it says 80 compressions per minute, and then D is less than 60 per minute? So how fast do you think we have to compress per minute? All right, here we go in 3, 2, and 1. And the answer is A, 100 up to 120 compressions per minute. What song do we compress to, anyone? Do you want to put it in the chat? There's a song, I think it was created in the 70s, really popular. I'm going to type it in if no one beats me to it. You are correct, Capri. It is A. And the song that you want to compress to is Staying Alive by the Bee Gees. So every time that beat drops, ha, 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 that would be your compression pace. And if you compress at that pace, that is more than 100 beats per minute, and you would be in line with American Heart Association guidelines. So regardless of the age, we compress at a rate of 100 up to 120 compressions per minute, and that would be the appropriate rate. The next one, number 11. Chest compressions on an infant are delivered with the A, entire hand, B, fingers, C, the heel of the palm, or D, knuckles. Chest compressions on an infant are delivered with what? We'll reveal the answer in 3, 2, and 1. Yes, Sandrine. Yes, Danette. Yes, Renee. It is B. It's the fingers. And as soon as the image shows, I have 2 images there. Sometimes we have patients we have caregivers who have arthritis. And so whenever you see the 2 thumbs meeting in the center, we call that the 2 thumb encircling hand technique, which is permitted if you cannot use your 2 fingers. So if you're using the 2 fingers on the infant's breast to perform the chest compressions, but your fingers tired, just alternate and use the other position. All are allowable. So great job, team. Number 12, how many breaths should be given during a 2 rescue or CPR on an adult with an advanced airway? An advanced airway, whenever someone goes into respiratory arrest or distress in the hospital, you'll usually see like an intubation tube. We call it an endotracheal tube. We'll connect them to the vent, but sometimes we have to take them off the vent. So let's say this person who was on a vent goes into cardiac arrest. We're not going to leave them on the vent. We're going to connect the bag to their tube, and we're going to give breaths. How frequently do we give a breath? Is it 1 every 10 seconds, 2 every 30 seconds, 1 every 6 seconds, or 1 breath every 2 seconds? So what I want you to think about, Mamie, is how many breaths do we breathe normally per minute? What's our normal range, respirations? It's 12 to 20. So try to, whenever you do the math, try to give me an answer that will result in at least, close to 12 breaths per minute. And that answer would be C. Yes, Renee, it is C. You want to give 1 breath every 6 seconds. And I'm hopefully on this next page. So this is an image of somebody who, and it's not real, it's just an actor, somebody who is intubated. And so we have them connected to a vent. We would detach the vent, connect the bag. But another type of person who has an advanced airway is somebody who has a tracheostomy. If somebody has that incision in their throat with the tube coming out, CPR would not be mouth to mouth. It would be mouth to stoma. But instead of putting our mouths on their tracheostomy, we detach the mask from the bag and we give 1 breath every 6 seconds directly through their trach while someone else is doing chest compressions nonstop. And the reason why I have to talk to you all about this, especially as CNAs and caregivers, is because when you press that code button, you're calling the rapid response team. You don't get to leave. You're right there. You're part of the action. And sometimes we may have to intubate that patient. And so I just want you to be familiar with some of these terms so that when you see us doing things in the hospital, you'll understand them. Okay. All right. So, number 13, what is the appropriate duration when giving rescue breaths? Is it a rescue breath every second? B, rescue breath should last 2 seconds, excuse me. Is it C, they should last 3 seconds? Or D, they should last 4 seconds? Think about how long it takes for you to take a breath. No, Renee. The 911 operator told you to press 7. No. Yes, it is A. Great job, Liz. Great job, Renee. So it's going to be one breath. Excuse me. You deliver your breaths. It should take no more than 1 second to deliver a breath. If you give a big breath, so it takes you 2 seconds. Sometimes the breath, instead of it going down into the lungs, it can actually go into the esophagus and into the stomach, and we can make the person vomit. So whenever you're giving a breath, just 1 second, release it, and then you can give your second breath. This is an image of a bag mask device. In your hospitals, they're going to call them ambu bags. But normally, when you take your CPR or your BLS exams, we don't use brand names. So when I talked about us using the bag to deliver the breaths, this is the bag that we'll use. Oh, I see, Renee. Instead of telling you, yeah, and hopefully she was taught according to American heart standards, but that's why your facilities are kind of picky about the brand of CPR that you take, because other brands may say different numbers, or she just might not have had the latest information, but it's one breath every 6 seconds. Number 14, what are the correct steps when operating an AED? Y'all, this is tricky. A, open the AED case, remove the AED pads, apply the AED pads to the patient's chest, and then turn the AED on. I'm just going to give y'all the answer. It is B. This was hard for no reason. All those options. It is B. Whenever the AED arrives to the scene, even if it's your first time ever seeing it, turn it on. It talks to you and it's going to tell you exactly what to do. It is voice guided. So when the AED arrives, turn it on and then listen, follow the prompts. When you take your American Heart Association exams, remember what I told you. Always turn it on first and listen second. It is voice guided. It will tell you exactly what to do. Number 15. I should not have done you like this, but I have to introduce you to some new terms. 15. Which of the following is not a shockable rhythm? A, asystole, B, ventricular fibrillation, or C, pulseless ventricular tachycardia, which is not a shockable rhythm. So when you put that AED on and it analyzes, it is looking for a shockable cardiac arrest rhythm. So it's looking for an abnormal energy that whenever we press that shock button, the electrical impulse will try to normalize the heart's rhythm or that electrical rhythm. So, in other words, if the machine doesn't detect energy, we cannot deliver a shock. And so, the best response is going to be A, asystole. Asystole is the lack of energy. And out of all times, my image didn't show. I do apologize, you all. There was an image there and it's not showing now. Asystole is the flat line. So, whenever a person doesn't have any energy at all, the AED will not say shock required. The AED is going to say continue CPR. Okay, so not all rhythms are shockable, but that is why you call the advanced rescuers. If you're outside the hospital, you call 911. If you're inside the hospital, you press the code, and your nurses and your doctors will know what to do if we can't use the AED on the person because they're in asystole. Number 16, what should you do after attaching the AED pads on the victim's chest? A, give abdominal thrust. B, allow the device to analyze the victim's heart. C, check if the victim has a pulse. Or D, turn them on their side. So it couldn't have been C. I thought because tachycardia means fast. But yeah, it says which one we don't shock. So that's why it wasn't C, because C, that pulseless ventricular tachycardia, is actually a shockable rhythm. So asystole would be the one that's non-shockable, Renee. So yes, everybody, great job. What word do we say when it's analyzing a rhythm? We need to get everybody away from the bed. What's the word that we say? I typed it in for you all. Clear. Move everybody back. Okay, so when it's analyzing, we can't touch the victim. We have to stop our chest compressions because it's going to pick up our heart rhythm, and we don't want to have a rhythm that's not accurate, or we don't want the machine to say a shock is not indicated because we were still touching. And then whenever it analyzes and it says a shock is required, and then of course we still make sure everybody's clear, because if you're touching that bed when we press that shock button, you're also going to get shocked. And then we have to call another code team in for you, because sometimes the shock is strong enough to send your heart that's in a normal rhythm into an abnormal rhythm. So when they say clear, I really need you to move back, okay? Right. And so if you're interested in becoming a CPR instructor, we actually train instructors nationally. We have students who fly in from all over. It usually takes about 2 days to complete the process. So, for example, we just had a nurse from New York who just flew down. She let us know what her agenda was. We completed her instructor course on a Wednesday. She did her monitoring session on a Thursday, and she flew out of here on a Friday. So it doesn't take long. You all can become American Heart Association instructors, and I would love to mentor you. All right, number 17. Why is it necessary for the rescuer to experience recoil between each compression? Recoil is letting that chest go back to its normal position. So when you compress down those 2 to 2.4 inches, you let your hands and that chest go back to its normal position. But why? Is it A, to prevent injury to the patient's organs? Is it B, to allow the heart time to refill with blood? Is it C, to allow blood delivery to the brain? Or is it D, to give rest to the rescuer? Why do we allow the chest to recoil? Mamie is right. Good job, Mamie. It is B. So whenever you compress down on that chest, you're squeezing all the blood out the heart, you're circulating the blood. That's how we get the blood to the brain. When you let that chest rise again, you give the heart time to refill with blood. So CPR hurts. If you go faster than 100 up to 120 compressions per minute, what we find is you're going so fast, you're not allowing the heart time to refill with blood. So you're doing a lot of work with little benefit to that patient. So that is why we say 100 to 120 compressions per minute. Please don't go faster. So great job. Yes, it allows the heart time to refill, A. All right, and there's an image there of a heart. And so whenever you're thinking about the heart pumping, think about that ketchup bottle when you're trying to get the last bit of ketchup out that ketchup bottle and you kind of like swing the bottle. That's the heart's job. The heart is to pump that blood. We want to get it all out so it can circulate. And then it goes through the system and it comes back through the lungs, reoxygenated. Number 18, what is the correct compression depth for infant CPR? So we said adults was 2 to 2.4 inches. I will go ahead and give you child right now. Child is 2 inches, but this question is asking about infants. So would infants be A, 2 inches, B, 3 inches, C, hint, 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 1/3 of the child's chest diameter, or D, 1/2 of the child's chest diameter? What do you all think? It is C, Renee. It's C, Liz. Great job. So I'm going to put it in the chat. So for infant compressions, the depth is 1.5 inches, or for all ages, 1/3 depth of the chest. So I just put it there in the chat for you. So we're pressing that infant's chest in. And again, sometimes we feel like we're going to hurt this infant if we press too much. But remember, right now, their bones are not formed. They have their whole life, if we can get their heart rate going again, so to heal. But if you don't compress deep enough, we're not going to get any blood flow to that brain. And that child is going to have neurological deficits. So you still need to compress deeply, even if it's on an infant, 1/3 or 1.5 inches. And we're almost done, ladies and gentlemen. Number 19, while you are trying to relieve choking on an infant, the infant loses consciousness. What should you do? A, perform the Heimlich maneuver. B, perform CPR. C, do continuous back blows. Or D, transport the infant to the nearest hospital. You're trying to help this choking baby and they stop moving. What should you do? I see you, Capri. All right, so A says C, Mamie says C, A, and Renee. So no one says B. So this is tricky. Whenever the infant loses consciousness or a choking victim becomes unresponsive, that means that they don't have any oxygen. We put them on the ground, or if it's an infant, put them on a flat surface. We perform CPR. So at this point, we can't get it up. They're now unresponsive. They're not moving. We have to start circulating the blood, the oxygenated blood that remains, to the brain. And so whenever your advanced providers come, they can use scopes if they need to go down deeper into the throat. But what you're going to do is, after your 30 compressions, when you be giving your 2 breaths, look into the mouth. And if you can see the object, you can remove it by doing a finger sweep. For an infant, try to use your pinky. For an adult or a child, you can use your index finger. However, if you don't see the object, we do not recommend blind sweeps. You just can't go in there digging because you can push it down more. If you try to give this infant a breath, it may not result in chest rise because we know this infant has a blockage, but you keep doing the best you can. You keep circulating that blood until the paramedics get there. Number 20, this is the last one, and I thank you all for joining us tonight. So number 20, what's the first thing you should check when entering an emergency situation? A, the number of victims. B, the seriousness of the injuries. C, imminent dangers in the environment. D, the location of a first aid kit. What do you check for first? Hi, Dinette. I think I just saw you there. Revealing the answer in 3, 2, 1. Looks like we have one response. Anyone else? All right, Capri. All right, Renee and Mike. Great job. Safety. If the scene is not safe, you will not approach. I want you to think about here in Florida, we had the Pulse nightclub. It was shot up by somebody, and the paramedics don't go into the building first, you all. I need you to act like a first responder, a paramedic. They didn't go in the building first. The police went into the building. They cleared the scene. So unless you're trying to act in the role of a police officer, you do not go in that scene. You want to stay at a safe distance and call for help, because at the end of the day, I want to make sure that you make it to your families also. So You all, great job. Remember, tomorrow's video is going to be on infection control, and we will start that video tomorrow around 8 p.m. I'm going to go back through the chats now to see what questions you all have, but I am so proud of you, and I thank you all for spending time. Even if it's only 30 minutes a few days per week, I thank you that you chose to spend some time with me. So what questions do we all have before you go? You know I love you, Renee. If it's certification classes, usually they are not free, but we do offer knowledge classes. So if it's, if you just want to learn the skills because you're a caregiver, you're taking care of Papa, then yes, you can come in on one of our classes and we will train you for free. But whenever certification is attached to it, that's professional, that's for a job, that's when the fees actually come in. All right, so anyone else have questions? All right, so tomorrow is infection control, and I think either Friday or Saturday we'll do one on disasters. So you all, I appreciate you. I thank you so much, Capri, Renee, Lisa, Mike. It was a lot of you all tonight. A, Danette, Mamie, Renee, Liz. Oh my. Make sure I didn't miss anybody. If I missed you, blame it on my mind and not on my heart. All right, everybody, have a good evening. We're leaving this line in 3, 2, and 1.